One thing that we are going to be talking about today is the core, why it's so important, why your glutes are so important from an evolutionary standpoint, what makes the booty so attractive, the truth about imaging, and what dry needling is and how it can help you. Also, why that is so much different than acupuncture. Because hi, everybody. Welcome to Health Smoke and Mirrors podcast. I'm your host, Dr. Michael J. Sardo, Doctor of Physical Therapy and Dry Needling Specialist. And I just want to welcome everyone to this podcast where we debunk and clear up any misconception that there may be within the health, fitness, medical industry and bring you the best, most accurate information so you can make the best educated decision for your mind, body, and spirit. I hope you enjoy the episode, and please follow us on Instagram at DocSardoDPT and on YouTube at Dr. Michael J. Sardo. Hope you enjoy the show. Hey everybody, what's going on? It's Dr. Michael J. Sardo here, physical therapist and master dry needling certified therapist performing dry needling. One thing that we are going to be talking about today is the core, why it's so important, why your glutes are so important from an evolutionary standpoint, what makes the booty so attractive, the truth about imaging, and what dry needling is and how it can help you. Also, why that is so much different than acupuncture, because I've gotten a lot of questions from people as I've been doing more marketing and getting the word out about dry needling. People ask me, is it like acupuncture? And I explain to them, no, it is not. And here are the major differences between what dry needling is and what acupuncture is. So I guess we're going to start right here with dry needling with this whole conversation. Also, I want to get into a little bit about my own philosophy and how what I believe in and when it comes to getting people's lives back and basically why exercise and movement is so important. You know, we saw during the lockdowns in 2020 for COVID pandemic that people didn't know what to do when they had to be trapped inside their home. So this is a really important topic that is near and dear to my heart because of what I do and what it's done for me in my life. So let's get started then. Like I mentioned, there's a difference between dry needling and acupuncture. One of the biggest things that I like to explain to people is dry needling is an overall reset of the muscle. And we allow that reset to happen by creating the full chemical connection within the sarcomeres or the muscle tissue. So what happens is there's a point where the muscles get locked up, and when you get enough of these cells that get locked up, you don't have a complete chain that goes through in reaction for that muscle to now relax. So it gets stuck in this locked position. When we insert the needle and do our technique and our needle palpation skill, we allow that muscle to fully relax, that chemical reaction takes place and completes its cycle, and now you get this overall feeling of relaxation. The muscle releases, it just lets go. As we do that, we are affecting the fascial system. So when we affect the fascia, what happens is now parts of the body just get to relax. That fascia is like that white stringy stuff over a chicken breast or within an egg, between the egg and the shell if you made a hard-boiled egg ever. So this is one thing that really is very effective in releasing that structure in our bodies to allow just such a great sense of relief, and it allows for endogenous opioids to be released. This happens because of the nervous system change that we see taking place from the autonomic nervous system. Now, let me explain to you what the autonomic nervous system is. You have two different parts to that. Sympathetic, which is our fight, flight, or freeze. And then the parasympathetic, which I like to explain as like when you're hanging out at night, you're starting to unwind and relaxing. That's the parasympathetic. That's where our relaxed state comes in. That's also where the homeostasis comes in. So that's really important when it comes to dry needling, because what happens is as we allow this parasympathetic nervous system to kick in, you're allowing the body to get into a state of homeostasis. You might get a little fatigued and a little tired, but that's okay because we heal when we sleep. Sleep is so important because of this. So that's a really big point I want to make with dry needling and what it actually does for someone. It helps with pain, and it's not only that we're working the muscle tissue, but we are also inserting these needles into the joints, into the ligaments, and into the tendons to elicit this autonomic nervous system response. Acupuncture works meridians, and it also works energy lines. It's more Eastern medicine based, and I'm sure I'm not describing the complete difference between the two. There's probably more to acupuncture, but these are the points that I like to stick with. So forgive me if I'm, not giving 100% information on what acupuncture is. I know that it works meridians and energy points. It also claims to heal someone's gallbladder, let's say, or maybe a systemic issue that's going on. Dry needling does not claim to do those things. What dry needling does is the reset, and everything that needs to happen in healing, it speeds up. In fact, with dry needling is really interesting is that when we apply stim, that process of healing and pain relief happens even faster, because what the stim does is it elicits more of a response now in that endogenous opioid release. So not only do the needles by themselves allow for this natural occurrence of feel good chemicals to happen, but when you stim it, up to between 2 and 15 minutes, you're just having this flood of endorphins and feel good chemicals released in your body, and that's going to help us reduce the pain. So once we have reduced pain and reduced guarding around a joint, because of if a muscle is too tight, locked up, most people are familiar with something called frozen shoulder. That's just where the whole joint capsule gets locked up and you're not going to be able to really move the shoulder at all, raise your hand over head or anything like that. When we are able to release that and you restore full range of motion, now you can work on including resistance. So you're moving better, you're moving pain-free. So let's go ahead and create a correction to that movement pattern and get you moving properly, the right way, how you should be moving. And then what happens is we start to reinforce all of that with other types of modalities, like maybe some scraping, maybe some taping or cupping, maybe some tapping, some deputment, things like that are really going to stimulate that muscle to start firing properly again. And as we put weight through it and are able to put resistance through it with a good movement pattern, that's where you get strong. That's where you see the long-lasting effects. Now, when it comes to that, that's how I practice. That's the sequence I follow. What happens in traditional healthcare, you're in for 5 to 15 minutes, maybe with a chiropractor, and then you're out the door. With physical therapy, you're lucky if you're one-on-one, and you're lucky if that therapist is putting their hands on you. You might have an assistant putting their hands on you. You might have a tech guiding you in some exercises, and you may be misled to thinking that that's your doctor. It is not your doctor. It is very rare that I hear people, I was one-on-one with my PT the whole time. Well, it might have been a scheduling thing. You might be on Medicare. It's all different, but their traditional setup is not placing you in any alignment for success. It is not geared towards you achieving your goals. People who have goals, who want to be active, who want to exercise, who want to keep their bodies healthy for the long term, creating longevity, healthy, optimal longevity, that system is not for you. It has its place. It does wonderful things for people, do not get me wrong. But when it comes to going private and being able to really, truly spend time with someone who's going to listen to you and go over your goals and explain things to you and give you access to anything like, phone calls, like texting, email, anything like that, that's a huge difference from the traditional system compared to working private as well. Now, the reason I bring that up is because with dry needling, you have to be pretty accurate with your anatomy. I mean, you have to take your time to know the anatomy. I'm not just throwing needles in people without explaining to them the whole process of what's going on and how they're going to feel and anything like that. So I want to make sure that they are fully aware of where I'm going, why I'm doing it, and what they're going to expect afterwards. And we're gonna take some measurements, some range measurements, some strength measurements, and all that, and see the difference after the needling. So that's a huge thing that I like to do with people is take a pre and post assessment, objective assessment of, maybe a shoulder flexion. And that's a real simple one there. Or maybe bending over and touching the toes and standing. That's another really big one for people. So this is it's a very, very effective tool based off of Western medicine that just works such wonders for people. It is a great thing to do. There's nothing against acupuncture. It all depends on what you believe and what's going to work for you. I just know that what the difference is, as I previously explained, that's a really big one. But there's other things out there that people claim are going to work really well for them and all that. If it works for you and that's what you believe, by all means do it. It's not for everybody. Not everyone can handle it, and that's okay. It's just what works best for you, and how are you going to achieve your goals? How satisfied are you in the care and the service that you are being provided? Insurance, unfortunately, doesn't really care how you feel about the service you're getting. All that's going to happen is that company is billing your insurance for a couple modalities, techniques that they're doing, mainly exercise, and that's it. Whether or not you need needling, you need hands-on therapy, they're typically going to shy away from that because of how insurance is being reimbursed. That's my 2 cents on all of that stuff. So really the other part of traditional healthcare comes down to another topic that we have on the list here is imaging. The amount of people who I've talked with doing markets and being out in the public asking and talking with them, just even my own patients, that when they call me, do you want my MRI? Do I need an X-ray? Do I need this? Do I need that? The answer is no. Imaging is only good if there's really something serious going on. I like to tell everyone that if you're not going to have surgery, why are you going to have imaging done? We know it's not going to be cancer based off of our questioning. So if your issue is truly musculoskeletal or neuromuscular, we're going to be able to establish that in the clinic. Based on our special tests that we do, our movement assessment, our questioning, we're able to diagnose that, yes, this is, let's say, for example, a rotator cuff problem, or maybe a stability motor control problem of your thoracic rotation. So that means you're not really rotating in the upper back like you should. That doesn't mean that you need an image. If you had an image done to your back or even like your low back, you're going to have disc bulges. 88% of people have disc bulges in their back, and they are asymptomatic, meaning they're not having any problems. The pain in their back is not, the image is not telling us where the pain is coming from in their back or why they're having pain in their back. Oftentimes, the biggest culprit that people are not seeing, and this is a gold gem for everybody listening and watching, even practitioners, hip alignment. You have an anterior rotated innominate, that's going to wreak havoc on your low back and your sacrum and your knees and your ankle. It's just going to do so much, and no one's looking at these. People are being told, oh, you need a lift, you have a leg length discrepancy. Actually, you're not getting better from 6 adjustments. Let's your X-ray showed a bad back. Let's get you for an MRI. It's all a waste of time. People do that because unfortunately they don't know any better. And the theme of this whole podcast is to give you the correct information so you make the best educated decision that you can with what you got. So I've had people come to me saying the doc says this is the worst neck that they've ever seen. Well, 3 weeks prior, they weren't having any issue. They just slept funny and it really just lit up their neck. Were we able to help them? Yes, we were able to help them with manual therapy and corrective movement and showing them the proper movement patterns. But guess what we also found? Major imbalances in like the quadratus lumborum, and maybe their innominate was rotated. So we didn't just focus on the neck, although that was their major area of complaint, but all these other issues were tying into that, and that's where that fascia comes in too. If you have a problem with your low back, you're pulling everything down with it, and that fascia runs horizontal, vertical, diagonal, all throughout the body. It is a very intricate working system in our bodies that just play such a role, and if one part is too tight, you're going to have this pull all the way over. So imaging serve their purpose for those who truly do need it. It is something that's needed, but I think that it is overprescribed for a soft tissue injury. So what, your rotator cuff is torn? You don't necessarily need surgery because of that. And the surgeon's going to go in and do the thing, and then you run risk of infection. You run risk of it not healing right. And what's going to happen? You're going to have to rehab it the same way, probably less intense, honestly, to start, but you're going to still have to rehab it after surgery. So why not do it more conservatively? Don't go through all that trouble of being put under anesthesia, being put on pain medications, and being cut open, causing a huge, wicked inflammatory response, not to mention now tightening up the fascia around that entire joint. And now you're in pain, even more pain than the actual tear was giving you. And that tear could have been easily resolved based on doing a good assessment, a good screen, and applying proper treatment to it. and a progressive load to it to reinforce that and teach you new posture and new mechanics and how you're moving. So it's really tossed around a lot, I think, and people just kind of go blindly into being okay with that because yeah, that makes sense. Why wouldn't I want an accurate, detailed information on that? Well, it's detailed, but I don't know how accurate it is. Yeah, it tells you that there's a tear in your rotator cuff, maybe the supraspinatus, but you know, so what? How else are you moving? How's your thoracic mobility? How's your scapular mobility? What does that joint feel like? What positions do it to you? What are you doing when it hurts? How are you actually moving your arm? And then we go ahead and we establish a plan to correct all those things, and lo and behold, that rotator cuff is no longer an issue for them. Or they might still have the tear, but they're not moving pain-free with pretty good strength. And, those tendons and all that take time to heal. Quick story for you. My mother had a torn tendon in her posterior tibialis muscle, and she was told, you're going to need surgery, you're going to need surgery. Well, I told her, don't do surgery. It's a very risky operation to have done on the ankle because you never know. You're going to be down for a while. Other things can happen. So what ended up happening, my mother's a bit of a firecracker, and she's pretty smart, said, if you're telling me that this tendon needs blood to heal, and it's going to take a very long time to heal, how is it going to heal with surgery? And the few people that she met with were kind of dumbfounded by her objection to that, and they didn't really know how to answer her. So it's a valid point. If you're going to have operation done on a tendon, well, it's going to take you some time to heal that tendon still, and you're going to have some fascial restrictions around that tendon as well. So you're better off just having it done from a standpoint of, try conservative first. And if you really want to get better, you really want to achieve a goal, go private with your rehab, with your pain prevention, injury prevention, injury recovery, because that's where you're going to get the most bang for your buck. People think it is expensive, but it's more expensive to continuously take time off of work, go for imaging, go for doctor's visits, out-of-pocket co-pays, etc., etc. None of those things have even come close to helping you resolve the pain issue that you're experiencing, and you spent a bunch of money, you wasted a lot of time, and now psychologically it's playing a role on you as well now with the imaging, being told, oh, your shoulder's shredded or your back is the worst we've ever seen. That takes a toll on people, and I don't think that's right to be telling people all of that. There's a way to have some good bedside manner and not just try to scare someone to get them under the knife. There's other ways, there's other options for that. And that is one thing that I really, really am adamant about telling with people. If we don't make a difference and I think that there's something else happening, I will refer you out so you can get your imaging done because it makes sense to do that. But if you're making progress and we're seeing change, perfect. It's nothing more serious. Most of the time it's nothing more serious. If it were, we wouldn't really be seeing change, or it would be continuously coming back. And even if that's the case, maybe we're missing an area that we should have been focused on. And maybe once we make that change, then that pain goes away and it never comes back. And that happens. That's part of the practice. But just that information is just to really educate you guys on, whether or not you should have the imaging done or not, and kind of deciding, what you're going to do with that imaging. Take it to PT, so what? We're still going to treat you the same way because we're going to do our diagnosis on you. And most of the time, the diagnosis that we come up with is accurate. And that diagnosis is accurate compared to the MRI. And we're able to now resolve that pain because we can come up with a plan, given that we've seen how you moved and what you're feeling and just how the tissue is and how the tissue responds to treatment. So that's a really, really important thing. One other thing that's also sometimes missed is the core. As I explained, you have a rotated innominate, which is just another word for your pelvic bone to be rotated forward. People have really weak cores. They have this imbalance. The core, that lumbar spine, is really important, and it should be stable. It is our foundation. Before we move our limbs, before we do anything, we need to be activating the transverse abdominis, number one. That is our natural girdle. That muscle needs to be turned on, and a lot of people don't know how to do it. Either they're not being taught how to do it in the clinics that they're going to with any professional, or if they are, they're being misled into what the core actually is. So the core runs from your diaphragm down to your pelvic floor. How you know what the pelvic floor is: for women, you do a Kegel; for men, you do a Nod, and you kind of feel that activation down there. And then it's the side of the hips and your glutes. Now, also the low back, your latissimus dorsi, tie into that, and it all connects into this fascial structure called the thoracolumbar fascia. And this fascial sequence basically is the pinnacle of our center of gravity and at our low back, and that's where we get strength from. And so when people have back pain, this is one thing that I've noticed is really often overlooked, and the core isn't truly addressed. People are not being taught how to activate that transverse abdominis. If you go on my YouTube channel, Dr. Michael J. Sardo, and if you're watching this, you're already there, check out my video on what the core is and also how to activate it in supine and in standing. I educate all of my patients on this muscle. If you do not know how to activate it, you're going to learn with me because it is that important. I've taken professional bodybuilders, active military men and women, and people in great shape, and they're like, yeah, I know how to do my core. And I test them, and it turns out, oh, I wasn't doing that right. Well, here, let's show you the right way to do it. How is it more comfortable now? Yes, it is. Perfect. And we build off of all of that. So as we start to engage in the core and learning how to activate it, learning how to control our breathing with it, oftentimes we see a pretty significant change in people's back pain, or maybe in their posture. And that change in their posture now reduces neck pain or shoulder pain and allows them to make it through a proper range of motion safely without any issue. And obviously now once that can happen, we can strengthen and reinforce around it so it doesn't come back. That's the big thing with the core. And it kind of leads me into segueing like what the glutes are, why that's such an important part of your core. So primitively, the glutes are an evolutionary thing that you ever wonder, why people are so attracted to someone's butt, to the glutes. From a primitive standpoint, it signifies health. Think about this. You ever see a person who can't get out of a chair and they get stuck? That's usually because they have poor glute strength. They don't know how to engage the glutes to extend the hip. That is a primary mover, is hip extension. It's like a pelvic thrust. People can't get up. They arch their back funny and they do all sorts of things to get up, but the glutes are non-existent in working for them. That's not very good if you can't get up. You know what that means? You get left for dinner from a predator, or you can't get out of a chair. There's a lot of things. You can't use the bathroom, you can't get food, you basically can't be independent, and it's an unfortunate thing that's really missed. I've seen a lot in my practice that glute strength is often neglected when people come to me and have tried other things. They've not ever talked about their core properly or the glute strength. So when it comes to the glutes, that's just one of those things. It signifies health. So when you actually have a good butt, you have good glute muscles, something biologically in your brain saying that person can get up, that person can probably run and escape. That's survival. So survival of the fittest, that's Darwinism. That's one of those things where you look at someone and that's just an internal instinct. Like, okay, that person's healthy. They can get out of a chair. They have longevity. There was a few studies done where your chances of aging well and longevity in this world is determined based on your leg strength. Can you get off the ground without your hands? What is your leg strength like? Well, you're not getting anywhere if you can't turn on your glutes. That's a big, big deal. It is a big component of everything I bring people through. Not only am I educating them on their core, but I'm teaching them the right way now how to activate your glutes by a series of bridges. And so we tie that all into not just the transverse abdominis, but now we're hitting that pelvic floor, the glute minimus and medius, the glute max, and you're allowing the hip flexors to stretch out with this as well. And now, based on a little something called reciprocal inhibition, when the hip flexors shut off, meaning they're stretched, the glutes are contracted. However, if your hip flexors, like the iliopsoas, is too tight, the glutes can't be on. Those are opposing muscles. So the glutes are off. So if you have a anterior rotated innominate, your pelvis is anteriorly rotated, or you're both of them are so far forward. You see this a lot in like a gymnastics type stance, where that back is really arched and the hips are just kind of dumped forward. The glutes aren't really turned on like they should be because everything's being pulled forward and the hip flexors are wicked tight, and that low back now becomes tight. So we call this a lower cross syndrome. And how to treat that is starting to correct these muscular imbalances and then building off of that. This is the foundation. These are the building blocks that we have to do to get people back. So I hope that's making sense for everyone, and they can see why it's so important. One of the other benefits to dry needling comes with muscle activation as well. So it's not just about the recovery process and speeding up healing, but it comes down to when we insert the needle skillfully, we're actually able to not only allow that muscle to reset, but we're giving it some good awareness. So when that release happens, now the muscle has an opportunity to fully contract at maximum strength and length. So that's what we're really going to focus on. And let's use the glutes for example. If someone's really having hip pain, groin pain, pain down the legs, and we determine that yes, you can benefit from needling in the glutes, we're going to do that, and that's just going to not only get rid of the pain, but it's going to establish now a sense of stability and confidence in movement. People are not going to be so tensed up and afraid to move because they were told they have the worst back or the worst anything. They actually can feel that, oh, I can move. And given from an expert like myself, hey, let's move you this way. You're not going to break anything. The body is quite resilient. You're not going to break it by moving. You're not going to throw a vertebrae completely out of alignment, with anything like that, from moving, just because that's in their heads from being told based off of an image, take it easy or whatever. You can't squat. You can't do this. And I don't necessarily believe in that. Everyone has their own philosophy, but from what I've seen, the majority of people that I'm working with are getting better because we're releasing the muscles, we're reinforcing that foundation, and we're building off of that to create sustainable strength and stability in the core and proper movement patterns in the extremities, along with good stability in the joints like the hips and the shoulders to achieve the best mobility to now push weight, carry your kids, go golfing, play tennis, volleyball, ride a bike, just walk, just get out of a chair, do daily things that you don't even know you're doing wrong or poorly and putting yourself at major risk for injury. So the dry needling is a really effective tool in doing that. And that's one thing that I strongly encourage everyone to continue to participate in because it's such an effective tool. So the dry needling is a very effective tool that we see, and I want people to be aware of it in the whole process of muscle recovery, joint pain. It works for arthritic patients. It helps to just relieve so much and to do so much for people. It's very, very important incorporation. And you don't want someone rushing through any of that. You do have to be very precise, as I mentioned before. So people who are rushing through with any of that, I don't believe that that's right. I don't believe that that should be done for people. I think you really need to give people 100% of everything you're doing, and being extremely accurate in your diagnosis and your placement and your rationale as to why you're placing the needles where you're placing them and doing what you're doing to either activate the glutes, to help with the core engagement, to improve their mobility overall, to rid their mind of this toxic idea of you can't move because of an image, MRI or X-ray saying that you're so bad you can't move. That's more detrimental than anything. Movement is so important, and as we saw during the pandemic, like I explained before, gave a little tip on that, is people were not able to get out. You saw one of two things happen. Either people were getting out every day going for walks as soon as they were comfortable with it, or they were staying at home. And some people fell into a really bad habit of maybe too much alcohol, maybe just a little bit more binge watching Netflix, things like that. And that's not what we want. We want people to be able to move. If we're meant to move, that is why we're on this earth, is to move. You can't do anything if you're afraid to move, if you're in pain and you can't work out. That's a whole nother issue right there. Being in pain limits you from doing so much, and it wears on your mental health, and that's not okay either. A lot of people we saw suffered from a lot of depression and anxiety, amongst other things, going on during this pandemic when they couldn't move or do anything. So moving, exercise is literally the one thing that can pretty much cure anything, but people can't do it if they're in pain. So how do you get them there? Well, that's where someone like myself comes in, to get them to a point where, yes, you can move, you can exercise. You have to have greater awareness of your body and what's going on. And it's not just that, but it's understanding why you're doing it, why we're doing this particular exercise, why this particular muscle is so important for you to get it to contract. This is what it's doing. This is how we create optimal healing. This is how we create optimal movement and strength, and sustainable for longevity, for people to live here longer and healthier and be less of a burden on the system. It is cheaper to do it this way than it is to go to your doctor, get pills, go for an x-ray, go for an MRI, go to PT. You say it doesn't work because no one actually worked with you and they were only doing exercise. Well, if you're exercising in poor mechanics, that's not going to help. You're not really fixing anything. You're just going to wind up in the same spot that you were. That's like having an adjustment and leaving. You're not reinforcing it with anything. That's like having a massage and leaving. You're not reinforcing it. You're not taking it to the next level with anything. So that's only hindering you, and you fall further into this, well, it didn't work. Unfortunately, it will work. You just have to find the right practitioner who's going to set up an appropriate plan for you to take you along the journey to get you well. So the whole thing boils down to, if you can move better, you can exercise, and all the research that's out there, it's so simple. You can walk for 30 minutes a day, 3 days a week. That in itself, getting into that routine and creating a habit out of it, is something that's going to help your mental state as well as your your physical state. It's great cardiovascular work. It's low impact. So if someone has, aches and pains in the knees, it's a low impact exercise. It's easy to walk. We all do it. You take a brisk walk, you get the heart rate up a little bit, then you have a change in your physiology. You're going to feel better. Your body's going to move better. You're going to reduce the inflammatory toxins that are causing some of that pain in the first place. Not to mention, if you're holding the transverse abdominis contraction, or that natural girdle, while you walk, now you're doing a brilliant exercise to really strengthen the multifidi muscles that run up and down the spinal column. These muscles allow the vertebrae to side bend, to rotate, to flex and extend, and they're a great stabilizing force when everything around it is working properly. If we don't have this proper movement around, or this proper stability, those muscles are all fighting for a position on what are we going to do? How are we going to hold this together? And some are really tight and irritated, and others are really overstretched, and both of those are wreaking havoc on the nervous system, sending all sorts of different inputs and outputs. And what we need to do is kind of reset all that. And walking is definitely one way to allow that to happen. And there's plenty of different ways to kind of help those muscles calm down and reset, not just with dry needling, but there's other techniques. It's just knowing how to properly reinforce it afterwards. So my philosophy, to kind of wrap this all up, is you have to move properly. You have to take care of our bodies. We do so much with our bodies. We have to live in these things a very long time. And if we're not maintaining them now, and we're not paying for it now, we will be paying for it dearly later. I never knew anyone who was sick who wanted anything other than just their health. We take our health for granted sometimes, and I don't think that's appropriate. We really need to be blessed every day to be able to move, and don't let anyone tell you that you have the worst back, the worst neck, the most shredded shoulder. I don't believe that that's good bedside manner. I think that people need to seek out every option and not just settle for the norm of the lack of quality that they're getting by using insurance. I think that you need to seek out private care. I think that's the wave of the future, especially in my profession as a doctor of physical therapy. There's plenty of concierge doctors out there, and they're wonderful people. I myself work with a concierge doctor, and she's amazing. The level of help and assistance and just guidance I've gotten from her compared to when I had used insurance and gone to a doctor is just unrivaled. And that's what I'm creating with Platinum PT is a physical therapy that's total body, all encompassing to help people improve their life, improve their quality of life and their longevity, and create sustainable strength and good mobility. Because we all want to be here on this ride for a lot longer, and you're not going to do it if you're down and out, constantly in pain, constantly on medications. There's so many different avenues and ways to do that, to the healing process. And it's out there. You have to put a little effort into to seek it and to obtain it. So with that, I appreciate you all listening. This has been episode 2 of Health, Smoke, and Mirrors. I hope you guys got plenty of information out of it. Always remember, please do follow me on YouTube. Hit the subscribe button up there. It's Dr. Michael J. Sardo for those of you listening. My Instagram is Doc Sardo DPT. Follow me on there for little tips and tricks as well. And you can always go to drmichaeljsardo.com/blog to see the latest blogs that I have up on dry needling, health, wellness, and your overall well-being. Guys, if you ever have any questions, please feel free to hit me up on any one of these platforms. I'd be happy to hear from you. I know that some opinions are not shared, but that's just what I believe in, and that's I always try to seek the best for people I see and provide them with the latest and greatest information that is unbiased because of a kickback from an insurance company or pharmaceutical company. Not everyone's like that, but it does happen out there sometimes, and I just want to be able to provide the best quality care and service for anyone I'm servicing, because I know what it's like to be down and out without exercise, and it is such an important factor in the mental health for people, and to get them through the toughest times that life has to give them. And if we can just get out of pain to do that, I think the world would be a better place. And I want people to live long and happy and healthy lives and enjoy their time with their loved ones here. So again, guys, thank you for listening. It's drmichaeljsardo.com, Doc Sardo DPT on Instagram, and Dr. Michael J. Sardo on YouTube. Thanks, guys. You have a great day. We'll catch you next time. See ya.